Today I have with me Dr. Ahson. She is an internist and pediatrician affiliated with Tampa General Hospital, as well as an assistant professor with USF Health, focusing on global medicine. Hi, Dr. Ahson. Thank you so much
Hi.
for joining me today.
Of course. Thanks for having me.
I really appreciate giving me some of your time, especially during this busy schedule. For all of our listeners who don't know me, my name is Azdal Mashal. I am a second-year medical student, and I will be conducting this interview on behalf of the International Medicine Scholarly Concentration. So before we really dive into our main topic, can you just tell me a little bit about yourself and how you got into the field of global health?
Sure. So as you said, I'm an internist and a pediatrician. So I work as a med peds hospitalist for USF at Tampa General. And I got into global health, I think, starting before even medical school. I started volunteering abroad. My first volunteer experience was in Tanzania. And I think that really opened my eyes as to what kind of work a physician can do and the impact a physician can have in developing settings. So in medical school, I continued to go on medical trips that were with my university and through residency. And I was so encouraged kind of by what I saw and the impact I saw that we could have as a physician that I pursued a master's in public health at the London School of Hygiene and Tropical Medicine. So I have a public health background as well. And kind of after residency, I think, is when a lot of refugee crises started worsening around the world. And so I kind of stumbled into the refugee crisis or the refugee populations kind of by accident, I think, just because it was they were the predominant humanitarian crises around the world. So I started working a lot with refugee populations around the world. So most recently with the Syrian refugee population and the Rohingya refugee population. So I've traveled since residency to many countries. I think I've been to 7 total so far to provide humanitarian assistance and help improve some healthcare settings in those areas.
Wow, I usually hear that people get their public health degree before medical school and then they do it. But you had a medical background and then it makes you like the best candidate, I feel like, to go into this field like of helping refugees and all that. That's unbelievable.
So I actually did my MPH during medical school. I felt so strongly about making this what I wanted to do with my career that I actually took a year in between 3rd and 4th year, and I went and I studied overseas in London, and I came back and then went into residency. So I think for me, having that training, at that point in my medical career really helped change how I look at, I think, certain health problems, and it's really, I think, been useful for this type of work.
And why, in your own words, so why would you think global health is so important?
I think global health is really important because as communication and travel have improved, our world is getting smaller. Populations are more transient. People are coming and going to different places now pretty easily. And also with refugee crises worsening around the world, there's more refugees now than any point in the history of mankind. Populations are migratory. They're moving, they're between countries, between borders. And so I think it's really important that, the field of global health is changing. And as we tackle more problems like pandemics, like the COVID-19 pandemic, such as climate change that's going to affect us all, these are all problems that the field of global health will be working on.
Yeah, absolutely. I agree. Actually, you bring up a really good point because I've never thought about it this way. But if you would go back like 100 years ago, it would have been so much harder to help people, let's say in refugee camps in Jordan, whereas now we actually are able to help, and that's why like we can do the change that we want to see. So that's a really good point. I don't know why it's never occurred to me.
That's true. And I think even the last 10, 15 years, I think people are traveling a lot more
Yeah,
because of
absolutely.
social media. There's a lot more awareness about problems all over the world. So I think, there are a lot of different, um, the world's getting smaller. So I think, as we think of global health, we have to change how we think about it because the problems are transitioning just as the populations transition.
Yeah.
Mhm.
Okay. So shifting the topic just a little bit,
Sure.
I can assume that the all of your international projects that you've been volunteering in and stuff like that have been halted or probably slowed down significantly after the COVID pandemic. So maybe you can tell us a little bit more about what you were specifically involved in, some of the projects, just like the stuff that are more memorable for you.
Sure. So yes, unfortunately, because of COVID-19, we haven't been able to travel as much. And really, until there's a vaccine, I don't anticipate people being able to go into refugee camp settings, just because of the risk of, causing spread there through an asymptomatic carrier or, in that way. I think, until for the foreseeable future, unfortunately, I think some of this work will be on hold. But prior to COVID-19, I have been actively involved, as I said, with refugee populations. I was in Volunteers and Networks chairperson of an NGO called Med Global, and they are dedicated to combating healthcare disparities around the world and have projects set up with local partners um, basically all over the world. So most recently, I've been traveling a lot to Bangladesh, to Cox's Bazar, to the Rohingya camps. I'd been going about twice a year the last couple of years. And then I'd also been traveling with Syrian American Medical Society to Jordan to work with the Syrian refugee population. My last trip before COVID-19, actually, my last medical trip was to Pakistan with Med Global, where we worked with a local charity hospital that's well known in Pakistan to really help develop and train the staff to improve their healthcare systems. So we did helping babies breathe and survive. We did ultrasound training, and the course that I was in charge of was empathy training. The staff had actually asked for it and specifically. So empathy training and how to deal with patients, how to deal with kind of customers. And the training was for actually people that were non-clinical, so receptionists, food staff, all the way to physicians. So you can imagine that was such a wide
Yeah,
varied group of people, but it I think was really well appreciated, and I think from the feedback that I got, that I think people really felt that they could apply this to their work. So I think Med Global is dedicated to not just providing humanitarian help and just um, being doctors for the time that we're there, but improving health systems from the inside by improving the capacity of local countries' health systems.